Welcome to Centauri Health Solutions Best Practices Toolbox. I'm your presenter today, Dawn Carter of Centauri Health Solutions, and today we're going to talk about how to renovate your data submission program. This is part one of a four-part series focused on the best tools to have in your risk adjustment renovation toolbox for your data submission programs. The tools we will discuss today include a magic bullet, a highlighter, and a blueprint. And these tools will help you reduce system and submission errors for EDPS and RAP submissions during the parallel period. In fact, the recent release of the Payment Year 2022 Notice of Methodological Change for Medicare Advantage announced the much anticipated final sunsetting of parallel EDPS and RAPS encounter data submissions. For the 10 years leading up to this sunset, member risk scores were calculated on a blend of EDPS and RAPS data, with the EDPS portion increasing year over year. This was done to give MAOs plenty of time to implement the people, processes, and technology necessary to successfully negotiate the increased operational changes attributable to EDPS and to minimize financial impact to risk scores as MAOs addressed issues with EDPS data completeness and accuracy. Back in June of 2017, CMS thought they would be helpful and publish a list of 12 best practices for encounter data submission in order to provide some guidance to health plans concerning the completeness and accuracy of encounter data. They did this at a time when they began to set more operational metrics for encounter data submission completeness and accuracy and began to report on these through quarterly report cards. Although it is certainly very helpful that they published best practices, what is more important is guidance on how to implement these best practices. Every health plan or MAO is different in terms of the people, processes, and technology they need to be successful at encounter data submission. And this webinar series is intended to provide insight into the tools health plans need to implement these best practices. Since I am a visual person, I opted to present these best practices as correlated to an actual tool you might find in a toolbox. This makes sense because with these best practices, we are building a best-in-class data submission program or renovating one that might have seen its better days. We'll spend a bit of time on how providers contribute to the implementation of these best practices, since they are the ultimate source of the data that is required for encounter data submissions as well. It's also worth mentioning that although the CMS best practices were developed for Medicare Advantage, most, if not all of them, are likewise relevant for other lines of business, such as state Medicaid encounter submissions and commercial edge server submissions. So let us get started on opening the toolbox and seeing what is inside with part one of our webinar series. So Magic Bullet, and that's where we'll start, isn't really a tool, so to speak, nor is it really magic, but I wanted to present a visual of the one thing that cuts through all of the noise that can make it very hard to know where to start with implementing these best practices for data completeness and accuracy, and that is good old analysis. I'll also use the visual of the Magic Bullet blender that you see advertised on TV infomercials, since it too is a tool that makes quick work of what can be a complicated process of food preparation. If you had only one thing you could do to get to the root cause of revenue leakage for encounter data submission operations, it is this: an analysis that consists of review and reconciliation of submitted encounters to rejected encounters. Ideally, this is done most effectively with an automated tool, a number of which are developed by companies such as Centauri, but it can be done manually with the right subject matter experts. Once you have completed this analysis, you are then armed with the information you need to develop specific strategies to address data quality issues. We'll look at an example of how to conduct this analysis now. So because the industry has been submitting data using the X12-837 electronic format for quite some time, we've seen the emergence of various root causes of issues with data completeness and accuracy. Because I've worked with many clients and also because I've worked in just about all parts of the revenue cycle, including claims processing, I can tell you that the more aligned the health plans or their clearinghouse inbound edits for claims submitted by providers are with the edits CMS employs for encounter data, the fewer issues there will be with data quality. So that inbound versus outbound alignment is critical with those edits. That's because, as I said before, the providers are the ultimate source of the data that eventually gets submitted for the purposes of encounter data submission. So it makes sense that these edits should be aligned. If they aren't, the chances of rejection increase. If a plan is using a clearinghouse, it will want to ensure that this alignment is occurring at the clearinghouse. If not using a clearinghouse, those responsible for the claims processing system edits at the health plan should perform this alignment. Do not let provider abrasion be your excuse for not doing this. Providers will certainly experience abrasion if financial losses from the health plan start affecting their payments and the quality of the care they give to members. We'll talk a bit later in our series about provider engagement. Continuing on, I also call attention to enrollment errors as a very common root cause of rejections, especially these days with the introductions of the HICN to the MBI transition and how that's been proceeding. However, most health plans operating in the Medicare Advantage space are no longer strangers to reconciling the monthly CMS membership reports to their internal enrollment systems. Despite that, I still see health plans experiencing high rates of rejection due to these enrollment discrepancies. A best practice is to check the enrollment of the member on an encounter before submitting it to CMS, and if there is a discrepancy, resolving it prior to submission. There are many automated tools on the market that can help you do this. Along those same lines, provider NPI issues still plague many health plans. Given that a single 837 transaction for a member can have many reported providers, it's important to ensure that internal provider registries are aligned with NPES and to check the NPIs on encounters prior to submission against NPES. Unlike the pre-2012 world where only wrap submissions existed, CMS now has well-established metrics that govern data completeness and quality and has since 2016. They issue quarterly report cards to each contract that report on these metrics, and each contract is measured according to benchmarks set by an aggregation of the plans of similar size. Outliers, or those not meeting the metric, are clearly highlighted in yellow. I have two pieces of advice for plans not wanting to be identified as outliers. Clearly define the encounter universe and establish an early warning system. When we say encounter universe, I want to be sure it is understood that this is not simply what was paid or denied by the health plan. For example, claims volume that is rejected by the clearinghouse, held in pended status, not auto-adjudicated, sent out for internal review, held for appeal, etc. So these are claims that are outside the normal average workflow, might not show up in the denominator and give a plan a false sense of submitting complete data when they really aren't. Look at every input into the universe from the start of the revenue cycle to the end, not just what resulted in being paid or denied. Also, incorrectly accounting for duplicates and adjustments can affect the universe, as can incorrectly accounting for supplemental data submissions. Your correct definition of the universe is your first step in establishing an early warning system for data completeness and quality, and the second step is establishing a plan for addressing parts of that universe that cause submission delays or inaccuracies. Otherwise, you risk being surprised when your report card comes out. It's like our own performance reviews or any other results-driven process. One should never be surprised by the results that are revealed in that report card. Now, most people wouldn't dream of building a house or other major project without a blueprint or a map, and this is no different. The key to achieving an integrated and high-quality process for encounter data submission is accountable partnerships. There are many parties involved in the creation and submission of encounter data, and it isn't just the claims or just the IT department. There must be a clearly defined and documented deployment of all people, processes, and technology, and the accountabilities between them. Most of the time, if it's not documented, it isn't being done. And you can't measure what you don't monitor. And you can't monitor what you don't measure. Regularly scheduled meetings between these parties are critical. Be inclusive at these meetings and in communications, especially for external resources such as vendors and clearinghouses, and be sure that these external resources are giving and being given visibility into the status of operations. It's your data, and you are paying them to manage its completeness and accuracy, so insist on visibility and accountability. A good first step is to insist upon reports on data quality and quantity at least weekly, and compare those reports with what CMS accepts and rejects in order to realign edits and close gaps, as we discussed earlier. Another common challenge I hear is that vendors and clearinghouses have long change control processes, so ensure that they are resourced appropriately and can properly support your needs for addressing gaps in completeness and accuracy. Likewise, you must ensure that you have the correct internal resources, such as subject matter experts, to effectively engage and partner with these external resources. It's also important to note that, quote, more is not necessarily better, and a whole army of the wrong people can do more harm than good. It also does no good to engage and partner with participants who are not empowered to make changes. Usually, the person with overall responsibility for risk adjustment operations needs to be able to keep the focus on how much incomplete and inaccurate data costs the organization, and uses this information to facilitate changes that will result in integrated and high quality data submission processes. So, to summarize, in part one, we focused on some tools to help maximize data completeness and accuracy that are even more important now with the impending transition to 100% EDPS risk based scores. In part two, we will turn our attention to tools for building stronger provider partnerships. They too have an important role as the transition to 100% EDPS risk based scores continues, so be sure to continue building your toolbox by tuning in for part two. Thank you for joining us.